counting the
cost.
Okay. Welcome, Jaime. It's good to have you here.
Thank you. Thanks, Lily and J-Rock.
Hi,
for
Jaime.
having. Hello.
So, how was your chemotherapy?
Okay, we'll just jump right in. So my chemotherapy, it was long. I did it for 9 to 10 months.
Wow.
And I just ended this past May. So it was a long journey. But it entailed of a cycle of chemotherapy every other week. So it would alternate between 5-day cycles and 2-day cycles. So I would have a 5-day cycle, then have a week off, then have a 2-day cycle, then have another week off, then do a 5-day cycle, and it would go like that.
Wow.
Yeah, so it was long and it was nauseating. Most chemo patients would tell you. Nausea, loss of appetite. It just, like the first session I went to for chemo at the hospital, after the 5-day cycle, I was wiped out. I felt so tired and just sick and just not well. Because my body had never undergone that.
Yeah.
But as each cycle went on, my body kind of adjusted to it. I still experienced the nausea and vomiting, but I wasn't as wiped out as before, and it usually took me about a couple days to feel normal again.
So what's the process of the chemotherapy? Actually, I'm not really sure about. Like, do you go under a machine, or do they poke needles in you, or?
Yeah, so that's a great question. I didn't know what it was like when I found out, I would be going through that. So it's chemotherapy, it's a very strong medicine, drug, and a lot of times they'll put a semi-permanent port inside of you. So you can't really see it here, but I have like a scar, partly from the port where it was placed in. And it's kind of, the doctor or one of the medical staff explained it to me, like it's like a button they put inside of you attached to a catheter, and it goes directly to your heart. So you don't always have to get poked. You get the chemotherapy because it's a liquid medicine. At least the one I did.
Yeah.
So when I was going through for my chemo cycles, they would just access it with a needle and then hand the bags of chemotherapy, and it would go through my body like for a couple hours.
Wow. Couple hours.
Yeah.
So did you say the word from hard to see something and then the needle? Which word did you use?
So, the port, it's like they insert a catheter in, and it goes directly to your heart.
Catheter?
Catheter? Is that like
catheter,
a
tube?
Like a tube?
Yeah, it's like a tube, yeah, exactly.
It's a tube that goes directly to the heart.
Okay, what do you call it again?
Catheter.
Catheter.
Or you can call it a port, yeah.
Port.
Or
like the port.
A porta-cap, yeah.
Oh, okay. Like the one where the ships come and that one? Port? Same spelling?
Well, yeah, it's another port, but
okay.
It's the same spelling, yeah.
Okay, it's a tool, it's a device.
Yeah, it's a medical device.
That is inserted into your body as a tube.
Yeah, and when I finished chemotherapy, I had my port removed. Thankfully, they checked, scans to make sure that the tumor was gone. And after that, then they removed the port.
Okay.
So
to make sure
I don't have a port.
To make sure what was gone?
To make sure
the tumor, the cancer.
Oh, the tumor was gone.
Before they removed the port. How long was the port? Like this long?
I never actually saw, but I think it goes from here to my heart. So
Whoa!
That's amazing.
Whoa!
That's so crazy.
That's amazing.
Wow, I can't believe having that inserted into my body.
I know. So when you feel it, when it was inside of me, it's just like a little button
Just
Like,
felt like a little button.
sticking out. Yeah.
Oh, button.
It felt like
That's
a
what
little
it-
button.
Yeah, feels like. And that's probably how they explain it to like kids too who
Yeah.
have
Does it require some kind of painkiller or something when it goes in? Does it hurt?
when they put it inside, yeah, they put some local anesthesia, so you don't feel it.
Oh, you don't feel it.
I didn't feel it,
So-
thankfully, no.
So how many hours was the therapy?
The chemotherapy, so when it would take a couple hours, mostly the whole day, yeah.
Couple hours or all day? And you said, and you said you use the word 2-day cycle and 5-day cycle. What does that mean?
So yeah, when I would go in for my 5-day cycle, I was there, yeah, pretty much the whole day. And for my 2-day cycle, I was also pretty much the whole day. But sometimes, depending how they call it there's a word the doctor used for it, your pathway or I forget, something like that. Because every cancer patient, it's not the same treatment for every cancer patient. Because there's like over 200 kinds of cancers. So some take it by mouth, some have it
Really?
infused, like I did. Yeah. So,
Some through what?
Through by mouth.
I'm sorry?
You take pills.
Oh, through
Or liquid by mouth.
liquid by mouth, or some through pills.
yeah, or through infusion through the port, like mine was.
Oh, you said the
Yeah.
infusion.
Yeah, infusion. So it's infused inside of me.
Oh.
So I go to the infusion center for my cycles. I mean, first I started going to the hospital, but after a few months, I was able to do outpatient at the infusion center. So I go there for my cycles, whether it was a 5-day cycle or a 2-day cycle.
So when you say 2-day cycle, it means it goes on for full 2 days.
Yeah, I mean, not day and night. I would go there in the daytime.
Okay. So during the day, a few hours, and then the next day again.
Yeah.
2 days in a row.
Yes.
Okay. That's what. Okay.
And then your 5-day cycle, you do 5 days in a row.
Mm-hmm. Yeah, 5 days in a row. Sometimes on the 2-day cycle, I'm trying to remember, it would sometimes be shorter, especially like as I got towards the end of my 9 or 10 month treatment. So I remember there was some times where I would only have to go in for like an hour. So those are nice days.
Yeah, that's nice. That's pretty nice.
So you started with longer cycle, like 5 days, and then it kept going down and down and down, pretty much.
Yeah, kind of, yeah.
Oh.
But I would still have my 5 and 2-day cycle. But yeah, as the months went on, at least it seemed like it was getting shorter, unless I was just getting used to it. But
Oh, I see.
Wow.
So when did the doctor ask you to make a decision whether you were going to start having this therapy, or did he like give you several options, or was this the only way he said you should go to?
so for my cancer doctor, my oncologist, she was nice, but I should say but, and she didn't really give me an option.
Okay.
Yeah, it was just kind of like, because I was, this is it. This is the only treatment that is, researched and studied and documented. This is the standard care.
Okay.
Or what I had was Ewing sarcoma, which is typically a pediatric cancer, but amazingly, I had it as a young adult, which is rare. I mean, it's already a rare cancer, but it's even rarer to have it as an adult.
Yeah.
But it still happens, and so I was one of them.
So when you say
the rare.
So when you say the word oncologist, that's a cancer doctor.
Yes.
Okay. Oh, I see.
So yeah, she didn't really give me an option. Like, you mean like natural therapy or chemotherapy?
Okay.
Yeah, no, she didn't do that. And yeah, she was doing what she knew, what she was trained in, and I really appreciate her advice or her her expertise in the field. I don't like the side effects of the cancer or the chemo, but yeah, it's a necessary evil, I guess, in some cases.
Okay.
So,
Wow.
yeah.
So do you have to like have future follow-ups like later on to go in and get it checked again?
Yeah, so I'm technically, in the surveillance stage.
Surveillance.
So usually for cancer, they say after 5 years and then you're good. Or I mean, no matter how old or how many years pass, you can always get it again.
Yes,
but that's when it. But for Ewing's, it's 8 years. So so for the first year, I'm supposed to get follow-ups every 3 months, and then down to every 6 months, and then down to once a year.
Wow. So it's very interesting how you said this is the kind of cancer only children are supposed to have.
Yeah, it's a pediatric.
And how did it work in your adult body?
Yeah, one of my friends, I think she was trying to make me feel better. She's like, "See, you ate so healthy, you tricked your body into thinking it was still a teenager."
Wow.
Yeah.
That's amazing. So what happened before you went to get yourself checked? Like, how did you realize that there was something wrong with your, like, what were the symptoms of the cancer?
Okay, so 7 months before I found out about it, I was having like this numbness, or like, I don't know how to describe it, electrical,
Like tingling?
pain.
Oh.
Yeah, kind of like tingling or numbness going down my arm, and I just thought, it was due to bad posture at work, or sitting at a computer at work all day, or my desk needs to be changed or something. But it wasn't just go away and then it would come back, just random times.
Yeah.
And then 6-7 months later, then I started having trouble walking. Like, my balance was a little off.
Oh.
And then my knees would start to buckle during the day while I was walking.
Really?
And at that point, my friends and my sister was saying, maybe you should get it checked out by a doctor.
Yeah.
And so that's when I went and had an MRI, and they thought it was a schwannoma, which is a benign, a non-cancerous bundle of cells. It's like a benign mass of tumor.
Benign tumor.
But it's benign tumor, yeah. So that's what they thought it looked like. It was on my upper spine, from my thoracic 1 to thoracic 4, 2, 1, 6, 4. So but then when they did the surgery, that's when they found out, where they said it doesn't look like a schwannoma, it looks more like a cancer. So they had to do a biopsy to confirm, and it's Ewing's sarcoma.
So, where did you say it was? The tumor was?
This
Spine.
upper neck.
Upper neck.
Upper back, lower neck, I guess. Yeah.
Right here.
Oh.
Yeah. So like T1 to T4.
So you could feel it?
Was it protruding?
And one of my friends, I think he might have felt it, but because I was complaining of back pain. He was a physical therapist, and then he asked his wife, and he's like, "Here, feel this." Like, I think he thought I was, what do you call it? Scoliosis or something. Maybe this is mild scoliosis. They couldn't figure it out. But now looking back, yeah, maybe that was, the tumor.
Oh, they felt something.
Yeah, they felt something was off.
Oh, I see. So you were experiencing some kind of discomfort on your spine, and a physical therapist said something is not right, and you began to have bigger, more serious symptoms, and then
like my knees would start to buckle, and it just, especially towards the end of the day. Yeah.
Wow. So how did you feel when they said it was cancer? What came to your mind first when they said it's cancer?
It's like, feels like the floor is pulled out from under you, and
Wow.
yeah, you don't know what to think. I mean, I was, I guess, in denial for about a month.
Wow.
Because they had to do the biopsy, so I was like, there must be some mistake, how can this be possible? Maybe they mixed it up with another patient's diagnosis.
There's gotta be something wrong.
Yeah, something must be off, but yeah, it was a very dark time.
What is biopsy?
Like a
Like serious checkup, thorough checkup?
Yeah, like they took a sample of the tumor inside of me after the surgery, during the surgery, and then they sent it to, I guess, the pathology lab or wherever they do the biopsy. Yeah.
Okay.
Clinic or
so they could
student.
Okay, so they extract the sample of the tumor and then they check if it's actually cancerous.
Yeah, and just also to see, like, based on your genes, what chemotherapy would work best for you.
Wow.
So it's more personalized.
Oh, I see. Wow. It's actually very interesting to learn so many things from you. I thought chemotherapy was some kind of like you were going into
a bed,
some kind of like a capsule, and then they
radiate
and you come out from the room and something like that.
Yeah, well, there is also radiation therapy, or I did proton therapy, which is kind of like that, except I would go over like a pit. I would lay on this bed, and I would move slowly in, and then they would have this thing or this machine with the proton therapy go around me, and I didn't feel anything.
Okay.
So that was in a way nicer than the chemo because it doesn't really have side effects, except well, when it was combined with the chemo and proton therapy, after a few weeks, it caused a burn here. Like Jandra, my sister, she said it looked like I went through a house fire because it was.
Really?
It was, yeah. Thankfully, you can't tell now. It's all healed up nicely.
Oh.
But yeah, it really hurt a lot. Like it felt like I got mucositis from it, so it felt like I was swallowing knives.
Wow.
You what?
Swallowing what?
I felt like I was swallowing knives from the burn.
Really?
Oh wow, that's crazy.
I can't
Yeah,
even
the burn,
imagine.
the proton and the chemo combined wasn't a good combo. I mean, yeah, it's just the side effects.
But the proton therapy was meant to be like a positive thing for your body, right?
Yeah, and it was like the bad or the not so nice thing about these treatments is, yes, they do kill the cancer, but they also kill other things as well.
Yes.
Yeah. But thankfully, our bodies are just amazing and very adaptable, and so, and the body, one of the doctors, I think one of the medical professionals said that your body is always in a position of wanting to heal itself if you give it the right foods, environment, love, and support.
That's amazing.
Yeah, it is really amazing.
Because
your body's always in a position to heal itself.
Because people say the universe or this earth got started randomly without any purpose or any direction, without any mastermind behind it. But your body is going toward healing. And all these devices and all these medical system, all these different cares are orchestrated by intellectual human beings with specific goal in mind, and we think body is just has been randomly like started. So that's crazy. So, do you know the difference between what proton one and the chemo one do differently on your body?
So the proton therapy, it is a type of radiation, but it's different from regular radiation because it targets the tumor, whereas radiation will just
target everything.
It will hit target everything. So proton's nicer.
Oh, okay.
And so you're asking the difference between proton and chemo?
Yeah. So proton
Yeah,
is more zeroing in into the just cancer.
Yeah, it shoots at the tumor.
It shoots at the tumor.
Wow.
Tumor itself, and the surrounding areas, because there's also like invisible.
Oh.
There could be invisible cancer cells
Oh,
that is not showing up on the MRI. So the chemo is helping destroy all the invisible cancer cells that don't appear in your MRIs.
Oh.
And of course on the tumor itself,
Ah,
and rapidly dividing cells, of which tumor is.
So I guess most young people that have cancers are recommended to go through these things because we have stronger immune system, right?
Yeah.
I see. Yeah, when I first heard that you had cancer, all my memories came back. I mean, my dad passed away when he was 47 because of liver cancer. But I know you're super healthy. I've been to your house. Your mom's food was amazing. You lived in an amazing place where deers were running around, and I was like, wow, this house is really nice, and this is a really good family, and the worship was fantastic. You guys were hugging each other every morning, every evening. I love you, good night, have a good day, all these things, and I was like, wow, this is amazing. So, just to see that, like, wonderful family and all these like healthy diet, and when you're traveling, your mom was packing all the food and we were eating just that, and I was, wow, this is like a moving vegetarian restaurant in the car, and she was packing all the food for every single meal and just having a wonderful time at the time. So I was like, yeah, Jamie got this. I mean, she's super healthy, she's gonna go through it. So I wasn't too much worried about it. And your brother is a doctor, your mom who makes food, and so I don't know. So, but you said you just felt like the whole world was just coming down upon you. And then when you eventually heard that it's cancer period, how did you feel?
I thought I was scared or like uncertain about the future. Like, what does that mean? Like, am I gonna die?
Yeah.
I think all cancer patients, wonder that. And of course, then you have to decide what treatment do you want to do. So I guess I felt, unsure of the future.
So, sorry, continue.
No, I was done, yeah.
So when you heard the type of cancer that you had, and because it's rare, right? Mm-hmm. Did the doctor share with you the percentage of like living a long life, of past patients who have undergone the chemotherapy and then lived until old age, or like did she?
Yeah, she probably did, but I don't remember. When you first find out you have cancer, and then you're just going through your own process, and you barely remember what just happened. And so my mom and my sister came with me for that first appointment with the doctor, with the oncologist, to discuss the treatment plan, the success rate or whatever. And I think I googled it later on. And I think it was 70%.
70%.
Yeah, success rate or survival rate.
That's still pretty high. I mean, 70%. I mean, compared to 30%, but
yeah,
definitely a lot higher. But okay.
Yeah, so it's hopeful.
So what did how did you cope with the worries and uncertainties and stress and all kinds of negative feelings? How did you deal with that?
I think my faith in God helped tremendously, as well as my family's support and care, and my friends around the world who told me they were praying for me. That meant a lot to me. And journaling I journaled more this past year than I think I ever have, in my adult life.
Okay.
Yeah, someone said like journaling is kind of like emotional vomiting, and then you feel better afterwards.
That's very true. That's very
Yeah.
true.
So journaling helped, and my friends, as I was able to, on my good days, like when I wasn't on treatment, I would spend time with my friends, and that was, lifted my spirits, and or like keeping in touch with my peoples, my or people reaching out to me. I didn't get it back to them right away all the time, but I always appreciated them reaching out to me, and just still staying connected.
Wow, that's great. So you're a community of authentic care and love supported you all along the way.
Yeah, thank you. Yeah, that's the word. Community really was important.
Wow.
So how often did you meet with your oncologist during the 9 to 10 months?
Oh, every week.
Or every week?
If it wasn't the oncologist, it would be one of the nurse practitioners in the same clinic. But so every week I was having labs done.
Oh, so she does it for you, like the.
Yeah, they would always check my labs every week to make sure, because the chemo kills the bad cells and the good cells. So sometimes my hemoglobin would be low, so I would need a transfusion. My blood cells would be low, so then I would feel really weak and tired. So that's why I'd always have to come like once a week, get it checked.
Wow.
My blood.
So you said that you mean they will put more blood in you if you had low blood?
If I was too low, like if it was, I think below 8 or 7 or something like that.
So it's all the more reason to donate blood. Like we should donate
blood.
Yeah,
I always appreciated like whoever donated blood for me. Like, thank you, whoever you are.
Because we recently went to the blood donation truck that came to our community, and they said, "Oh, you've been to an area where there's malaria, so get out of this bus." So I couldn't donate my blood.
Couldn't donate blood.
Oh dear. And there's other opportunities.
Yes.
Yeah.
How long do you have to wait? A year?
I'm not sure.
Okay. Well, it's unfortunate, but.
I'm skinny, but and I'm vegan, and the only way to indulge in my dietary habit is to eat a lot. So these days I've been eating a lot, and then I didn't feel like the food was getting digested. And last night and yesterday I finally felt hungry because we took a trip with my mom, and I kept eating when I wasn't hungry, and my food that didn't get digested kept piling up, and it kind of like clogged my system, I think. So I think this battle for vigor and health is for everyone. It's not just for Jaime or cancer patients or with anybody with serious like problems. So I felt so happy that I felt finally hungry at nighttime, because by the time I was going to bed, I didn't feel hungry, and I had to walk like 2 hours, 1 hour. I was like, what's wrong with me? Why do I have to continue to walk when my wife is already sleeping? I have to keep walking at night like a crazy madman. So this is my personal battle that I need to fight and win. So what do you think you picked up from this journey when you were getting the therapy, and what kind of because my father passed away from liver cancer. He didn't drink a lot, but I think he overworked and it affected him. He was working for the government, and he's the kind of guy that would take up all the responsibilities to himself, and people say, "Oh, good job, you're a nice guy, and I'll give you more work." And my dad would do more, and he just collapsed, I think. So I'm trying to stay away from overworking. I'm trying to stay away from overeating, and just to keep up with people's expectations and the praises and all the I don't know, all these things. So that's what I'm trying to avoid. As a son that had a dad that passed away from that. life-threatening habits. People think it's benign. People think it's okay. It's admirable traits. But for me, that's what really got my dad. And I know that cancer takes usually like years to actually like show to be seen to be affecting you in a way that you have symptoms. So what are the things that you have learned in terms of your thought patterns or your physical habits, or I don't know, like what would you say to those people that enter the same path that you did? And
Yeah. So I think what you said is true. Like stress management is huge, really important. So doing what gives you joy, what sparks joy for you, whether it's hanging out with your friends or painting, going to the beach. I love going to the beach. And just, like taking time to listen to the thoughts that you're telling yourself. And so for me, like writing down my thoughts helps. I feel like I write better than I speak. So sometimes I have to write down, what's going on. Because sometimes we don't even think in like complete sentences. It's just like feelings or just like words. And so when you actually spell it out, then you can identify if you have any misbeliefs and then argue against that misbelief and then replace it with the truth. Whether it's, I'm a nobody, like nobody cares about me. That's a misbelief right there. Like, no, you are somebody. Like, people do care about you. In the infusion center where I went, they had this quote right in the front when you enter the infusion center, and it says, always remember that you are stronger than you feel and smarter than you think and loved more than you know. So
you said blood more than you know?
No.
Or loved, loved. Or you are loved more than you know.
Loved more than you know. Okay.
Yeah.
Wow, that's really powerful. So replace lie with truth.
Yes.
How about your value? How about your life? Wow.
I'm sorry. Oh.
So replace error and lie with truth. About your life, about your value.
Yeah, or even if it's just like you mentioned something earlier, like people's praises, or I don't know. It struck in my mind, like people pleasing.
Yeah, exactly.
Or just being really concerned about what people think of you or taking things personally.
Yeah, exactly.
And so sometimes, we get offended when we don't have to get offended because we think we know what the other person is thinking.
Yeah.
So whether it's like you're at work and you think, oh, they must hate me, or I think my boss hates me.
Yeah.
But you never had a conversation with your boss. These are just anxious thoughts or misbeliefs, incorrect. Like your feelings lie to you. Like I mean, sometimes they tell you the truth, but feelings come and feelings go. So feelings are deceiving.
Yeah.
And so you have to have some kind of anchor or some truth. That you have to replace the lies that you've been believing, the stories that you've been telling yourself. So yeah.
Wow. That's really powerful. So do you think you can pinpoint the cause?
I was actually talking about this with my doctor last time I saw her a week or so ago. I was like, because I don't want the cancer to come back.
Exactly.
Yeah, exactly. And she's like, well, that's a $1 million question, because if we knew the answer, no one would have cancer. And do I know what caused it? I don't know for sure, because I didn't have a family history of cancer. I tried to eat the best I could.
Yeah.
So life's not fair sometimes, but that doesn't mean that you have to have a pity party for yourself
Okay.
all the time. Just because when I found out, I had cancer, I had two choices. I could either choose to feel sorry for myself or ask why. Why is this happening? Why me? Or I could choose life and choose to keep fighting.
That's right.
And it wasn't always easy. There were times where I didn't want to live anymore. This is too hard. But I knew the truth, like, there are people who still care about me. Like, there's still a reason to live.
Yeah, that's right.
Wow. So, what's your plan for the future?
Yeah, that's a great question. I'm still trying to figure out the answer. But my plans, I mean, for the first year after treatment, I'm probably gonna take it easy, because my body went through a lot.
Yeah.
And even my doctor was, recommending, like, go back to work slowly. Like, don't start in full-time right away. Just start, maybe part-time, then gradually full-time.
Sure.
So for now, I'm just, I'm kind of helping out with family and enjoying life, living life to the fullest.
Enjoy your vacation.
Yeah, so kind of, in quarantine. I mean, not really quarantine, but in COVID times. But...
Oh, I see. So you're taking care of yourself and getting ready for the next step in life, and especially quarantining yourself against COVID-19, I guess.
Yeah, I mean, I still go out, safely and with people I know.
Okay.
But yeah, and reading a lot of books.
So, what was your profession? Well, I mean, what is your profession? Like, what did you do?
I'm a dietitian.
Dietitian?
Oh, you're a dietitian.
Yes, she's a dietitian.
Oh, I was gonna interview a dietitian and you're the dietitian.
Oh, nice, yeah.
Yeah.
I'll have to watch that episode when you have to do it.
Yeah.
Okay, very good. So you will continue to, what is it? Is it easy to find a job as a dietitian in California?
Yeah, you just have to be willing to work in any setting.
Would you say, okay, I know we're not talking about dietitians right now in this episode, but because, you need to take things easy, right, after chemo, is this area where it's kind of like, it's not too stressful?
Oh, I think every job has some degree of stress,
Yeah.
but it's how you manage the stress that makes the difference. So, for me, I love doing outpatient dietitian, like meeting one-on-one with the patients, making goals with them or helping guide them in their health journey. My strength isn't teaching large groups of people or classes. That kind of stresses me out. But I know if I put my heart and mind into it, I could get better. I could improve. There's always room for improvement.
That's true.
So,
but for now, to make it less stressful, just do one-on-one instead.
Yeah.
And then you can add as you get stronger.
Yeah.
Very good.
Wow. Okay, I have just a few more questions when you're done. I'm sorry for
Okay.
doing it so long, but it's so fascinating to talk to you. You got so much gems to share. So what did you do for that 9 months? Like on a daily basis, what did you do? You said you're reading books now. What did you do?
Oh, when I was during treatment, I was reading books, and sometimes the chemo.
Yeah, probably you felt like it's just so long, you have this thing here, and what do you do? What did you do? Yeah.
Yeah, so I would go on my phone sometimes, or sometimes I would just sleep.
Okay.
The chemo makes you nauseous, so they give you medications, anti-nausea medications to help bring it or hopefully avoid it, but sometimes it doesn't work 100%, so you still throw up and
I see.
And it wears you out. Yeah, so a lot of times I would just be just resting or sleeping.
I see.
from the side effects of the anti-nausea medication, like Benadryl, would knock me out like in 15 minutes.
Wow.
Wow.
Because it's supposed to, prevent you from vomiting. But which it did, in the sense that it also made me like knock out, so I couldn't throw up. So just resting and during the 9 months, reading a lot, writing, and my friends would visit me sometimes, and and people gave me stuff to do, like a coloring book for adults, and learn how to crochet kit.
Oh.
What did you say?
Learn how to crochet.
Oh, crochet kit.
Crochet kit.
Oh, crochet.
So like a yarn and a
Okay.
needle.
Okay.
And just people. I mean, I appreciate it, but sometimes like it almost got too much. Like people would always text me like, "How are you? How are you? How are you doing?" And so at first, like when I was first diagnosed or when I first had the surgery and everything, I had to like have my family respond to the text or just redirect it to them because I was just I couldn't really. I was so exhausted after the surgery. I couldn't.
Wow.
My body was just so weak. So for a while, they had to be the ones to communicate, how update them how I'm doing. And when I was, after a few months, I was able to respond to them myself. So it takes time to respond to people. So sometimes I would just spend time updating people or communicating with them. Yeah.
I had another question. So I know that healthcare in America is very expensive. Did you have health insurance prior to this, or how are you guys able to pay for all this?
Yeah, that was another miracle. But to make it short, so when I went in for the surgery, I didn't have any insurance. I'm not gonna go into why I didn't, but it was just because I was trying to pay off my student loans, so I was trying to only have the bare minimum, and I was like, I'm young, I'm healthy, I don't need insurance, but anyway, but it turned out to be a blessing in disguise because since I didn't have insurance, I went to the hospital for the emergency surgery, and they couldn't. There's some law that says that they cannot turn you down if it's an emergency.
Oh.
So, and the social workers are amazing people. They can help you, connect you to resources that you would never have found on your own. So they were able to get me enrolled in Medi-Cal, emergency Medi-Cal. So that thankfully was able to pay for my chemotherapy treatments.
Wow, praise God.
Whoa!
It was a miracle. So.
Wow, praise God for the medical system you guys have. Because when I was going through hypothermia, when I got so cold in the water in the summer, I almost died because my heart was shutting down. I was losing consciousness. And I called 119. We say 119 here, it's 911 there. I called the emergency, the car ambulance, and then they came and they covered me. And I changed clothes. I took off my wet clothes. I didn't know I had to take off the wet clothes. I was like shivering. I was uncontrollably, and I was like, because they were making ramen when I was like, my whole body was shutting down because they didn't know what was going on. And I was thinking, man, I'm gonna die here. And I looked up online right there and on the spot, and they said, you can die from this. I'm gonna call the professionals, and they came and rescued me from the imminent death. So. It's just so amazing to have those people ready to come and rescue me when I call them. So I'm so thankful to have those people. Wow, that's awesome.
Yeah. So I guess what is it, like the medical industry? It's good for when you're, I guess, in a more serious condition. But when it's just every day, like going in get checkups, it's not worth it.
So I guess even though Jaime was not paying for the medical care, somebody was paying them for you in case something like this happens to you, and then it happen to you, and their money came to you, right?
Yeah, something like that. Yeah.
Wow, that's so beautiful. That's so beautiful. Yeah, thank you, Jamie. I would like to
You're welcome.
celebrate your successful surgery, not surgery, successful therapy.
Oh yeah, surgery too. Yeah, and everything. Yeah.
But you went through surgery too?
Yeah, to get the
Oh yeah,
tumor.
to remove.
To remove.
To get, well, they got
Oh.
most of it out. Yeah.
Yeah, they got most of the tumor
And then
out.
the rest was.
The rest was through chemotherapy.
Oh, okay. So successful surgery, successful chemotherapy, and your emotional vomiting, and your physical vomiting. I guess you vomited a lot through this experience. Your whole being was vomiting.
Mm.
So,
That's right.
is there any last words of hope to the chemotherapy patients that you'd like to say?
I just say don't give up. Don't give up hope. Because once you lose hope, it's a very dark place to be, and you don't want to go down that path. And yeah, just remember that quote that was mentioned earlier. You're stronger than you feel, and smarter than you think, and more loved than you know.
Wow. Thank you so much for those words of comfort, Jamie.
So you don't call the word hope as something just emotional or theoretical or just imaginary.
You're asking me.
Yeah. Because people say, oh, hope is something imaginary, it's something abstract, it's something like theoretical, it's not real.
I mean, it's abstract in the sense that you can't actually touch hope.
Yeah.
But yeah, hope makes a difference. It makes a world of difference in your recovery.
Okay.
Whether you believe that you can get well, you will get well. There's hope for the future. I'm sorry, I don't know if that answered your question.
Yeah, I was just wondering how much role the hope play into a patient's life, patient's recovery.
Very important.
I think it's huge.
It's huge.
Yeah, vital
It's
for your healing and for your recovery.
Wow. Thank you for answering the question.
Yes, thank you, Jamie.
Thank you.
Thank you, Jamie.
Thank you.
Welcome.
Apologize for keeping you so long.